My name is Issa Abdalla. I'm a patient of Dr. Wolfstadt. Dr. Wolfstadt was the only person actually engage with me and feel my pain. I met a lot of doctors in my life, but no one listened to me the way he did. The first doctor, he did my surgery. He didn't even look at my knee. They give me all this pain medicine, and I said, I don't think so. I think there's something wrong inside the knee.
My name is Jesse Wolfstadt, and I'm the head of the Division of Orthopedics at Mount Sinai Hospital. What sets Sinai apart from other institutions is the volume of complex cases that we do. About 180 revision hips and 150 revision knees annually. But just for some context, that volume is more than all of the revision surgery done combined at all of the GTA academic hospitals. Issa had both of his knees replaced at an outside institution probably about 5 years before we met, and had redo knee replacements of both of his knees in separate surgeries 1 month apart for loosening of the implants. And he didn't exactly present as a rip-roaring infection that was easy to diagnose. Periprosthetic joint infection is a deep infection within a joint that's being replaced, and it really is the most devastating complication that can occur after a joint replacement. There are a number of reasons why PJI is so difficult to detect and so difficult to treat. Sometimes it's obvious. A patient comes in with a red, hot, swollen joint or has drainage from the joint replacement along the incision. But sometimes, as in the case with Issa, it wasn't so evident. When we sent for some of the more high-level next-generation sequencing, that's when it finally revealed that Issa had an infection in the knee, and it most certainly was what was causing his pain all along.
I'm a healthy guy. I like to do a lot of things in the gym and stuff, and I don't take those kind of pills, but I couldn't live without it. I was ready to cut my leg for the pain. It was pretty awful.
When we do a revision joint replacement, the infection risk goes up considerably. There are several studies that have actually shown that the mortality rate associated with periprosthetic joint infection exceeds that when compared to multiple common cancers. It typically involves multiple treatments, multiple hospital admissions, and it takes a real toll on patients.
Dr. Jesse goes, no, don't worry, we're gonna fix you. We're gonna find the solution for this. I'm with you. He gave me a little bit of hope.
We had to embark on the arduous journey of reconstructing the knee with a two-stage revision. It involves a first surgery where we take out the joint replacement and we put in a temporary knee replacement with high doses of antibiotics, and then patients will undergo their chemotherapy-like antibiotic treatment, and if the blood work and fluid from the joint remains normal, we can put in a more definitive knee replacement. And thankfully in Issa's case, he's a superstar and did really well functionally, but I know it was a long and arduous process for him, and it took a lot out of him both physically and mentally.
My knee can bend, the swelling is there, and I can't move. Now it was affecting me inside now, mentally and everything else. I mean, I have a big support at home, but there's days I locked myself in the room, I was crying, like, what am I gonna do?
There's a high rate of undiagnosed depression and anxiety in these patients. They've had a joint replacement thinking they're gonna get their life back, and now they're going through this long, onerous recovery. Patients will often blame themselves or ask why it occurred, and unfortunately, we often may never know. It's nothing the patient did. It's nothing that the surgical team or the perioperative team did. And then I think including that mental health aspect and understanding how much of a burden this has on patients will help us take a more multidisciplinary approach to the management of these patients. Patients that have cancer will be supported by counselors, social workers. That same level of care is not really afforded to periprosthetic joint infection patients, but I really think it should. And having some literature and some evidence that will prove that patients are in need of this will help us hopefully fund future studies that are going to improve care for patients. And that allows us to continue to be a world leader in complex orthopedic reconstruction. And we could not do that without the generous support of our special donors. We were very grateful to receive a generous donation of a robotic joint replacement system, and we performed the first partial joint replacement using the VELYS robot in Canada, which was really exciting for us. And it's changing the way that we're able to look after patients and address unhappy joint replacements and patients who have had complications.
I'm so grateful for the team at Mount Sinai to let me have a life again, and to see the light and to see the meaning of life, and to be able to do whatever I want to do in this world. Dr. Wolfstadt saved my life.